SVT. SVT is supraventricular tachycardia. Is defined as abnormally fast heartbeat. It's a broad term that includes many forms of heart rhythm problems that originate above the ventricles in the atria AV node that increase in electrical impulses so make upper ventricle beat rapidly. Supraventricular tachycardia occurs when faulty electrical contraction in heart or abnormal areas of electrical activity trigger and sustain an abnormal rhythm. When this happens, the heart rate accelerates too quickly and doesn't allow the enough time for the heart to fill before the contractions again. These effective contractions of the heart may cause you to feel light-headed or dizzy because brain doesn't receive enough blood and oxygen, so heart makes stimulation for the compensated system and start to pump rapidly. Causes of the SVT: heart failure, thyroid disease, heart disease, chronic lung disease, and also smoking is another cause of SVT. Another cause like consuming too much caffeine, drug use such as cocaine, certain medication including asthma medication or over-counter cold and allergy drugs. Signs and symptoms of SVTs: heart rate over 150 irregular, respiratory rate shallow and rapidly over 25 per minute, floating in your chest, rapid heartbeat, palpitation and shortness of breath. Also lightedness or dizziness, and sweating, and pounding sensation in the neck. Another symptoms of SVTs: fainting or near fainting, and low perfusion in lower and upper extremities, and cyanosis of face as late signs of low perfusion. Shape of rhythm: SVT is the near shape of tachycardia. QRS will be near each other, and P and T wave is difficult to distinguish from each other because it will be in the same wave. Treatment of SVT: make carotid massage from 5 to 10 seconds and make Valsalva maneuver that stimulate the vagal nerve to decrease heart rate. Other method is using adenosine after making carotid massage. Adenosine phase dose like 6 mg that followed by 10 cc of normal saline, and other dose is 12 mg followed by 10 cc of normal saline pushing directly. If the patient still the same, use the cardioversion by put the patient and sedative by diazepam or benzodiazepam group. Then synchronize the cardioversion by giving the patient shock. After monitoring the patient for 30 minutes, with synchronized cardioversion, we deliver the shock of R wave to ECG being monitored to wave sector 1. We can perform it by multifunctional electrical pads or external pads and 3, 5 or 10 cable directly connected to the heart start interrupted, and only functional pads. Here we use this button to select clear ECG pattern. It's indicate supraventricular tachycardia. Switch the monitor on, then discharge it by energy desire. Press synchronize. Then charge the monitor by press the charge button. Then you have to clear the patient. Then deliver the shock by press shock button. Here we have a sample of patient. The patient was 60-year-old with heart rate 120 and respiratory rate 25 per minute. Diagnosis: chest pain, difficult breath, and high blood pressure with 140 systolic. He has a history of heart failure, medication, aspirin, omeprazole, Lasix, and captopril. Also, he has a history of diabetes and blood pressure, high blood pressure. Lab result left and left was normal for the patient, and we start make a treatment gradually as a protocol. We start doing the carotid massage to stimulate the vagal nerve, and after giving the adenosine, we start to give the patient the shock by the cardioversion, and his case start to compromise gradually, and he discharged from the hospital. Thanks for listening.